Dr. Allie Braet with Kehoe Eye Care. Good morning, Dr. Braet.
Good morning. Happy to be here.
Glad to have you, and not a bad weather forecast, kind of a good fall weather forecast.
Yeah, it's perfect. I'm ready for the seasons changing here. It's awesome.
It sure is. Speaking of changes, a big remodel here at the Monmouth location. Tell us all about it.
Yeah, we're very excited. Last week we got all new flooring put in. This week we're getting some paint done. We're doing some new artwork and just some cosmetic upgrades just to welcome our patients a little bit more, make it a little more bright and airy and new. So yeah, we are very excited.
Remind people where you're located in Monmouth and Galesburg.
We are on the square in Monmouth. We are at 67 Public Square. So we are right near the alley, kind of across from the wine shop.
Catty corner to us.
Yeah, right by you guys. In Galesburg, we are located just north of the roundabout on Broad Street. We're in the old 4L Plaza, and that office had a big remodel in 2021. So, yeah, we're very excited to keep things new and updated.
Fantastic. Okay, well, let's talk about what you're here for today, which is an update to take care of our eyes. Yeah. You also take care of people, not just our eyes. So tell us about right now with these seasons changing, that means it's getting darker earlier.
Yeah, it is. It's getting darker much earlier. Unfortunately, daylight savings just right around the corner. So especially the evening commute is going to be in the dark for most people. So it certainly makes a big difference making sure glasses are updated and clean and that lenses are clear so that you can drive safely in the dark. Even really small amounts of uncorrected prescription are really magnified in the dark and can make driving difficult. Also super important to keep those glasses clean. Any smudges or scratches can really make the light scatter and really degrade your vision in the dark. And making sure you have that anti-reflective coating on the lenses, that makes a big difference too, which is awesome.
Yeah, what happens to the eyes at night? Because so as you get older, it seems like, things get a little further away or a little closer to your eyes, depending on what you are, and brighter. The objects get shinier and brighter.
Yeah. So in dim light, everyone's pupils dilate a little bit. That lets in a lot of stray light and light scatter. In our older ages, once we start to develop cataracts, that can really degrade vision at night. That's usually when people first start noticing they have cataracts, is that their vision at night or in the dark is just not as clear. A few different reasons why things are more difficult at night.
And remind us, what are cataracts?
Cataracts are the natural clouding of the lens inside the eye. Basically, the lens inside of our eye, it sits right behind the pupil. When we're born, it's nice and clear, but as UV light and just age-related changes happen, it can start to get yellow and brownish and cloudy, and so we're looking through that lens all the time. So really, vision starts to degrade and get blurry.
Okay. What can we do about cataracts?
Cataracts can be removed. So once they really start affecting vision, cataracts can be removed, and that can actually happen here at the hospital in Monmouth. There are surgeons that do cataract surgery there. So it's a very routine, easy process now compared to, just a couple decades ago. So
okay,
very routine.
Okay, and it's allergy season.
Oh, it is. It is allergy season for sure. Seeing a lot of that. We have the farmers out in the fields, which is awesome, but certainly have a lot of people suffering from allergies right now. A lot of itchy eyes, red eyes, really feeling burning, irritated, maybe feeling even like there's something in there, even when there's not. There are a lot of great treatments for allergies nowadays. So certainly if you're suffering, you don't have to. Definitely let us know and we'll find a good treatment plan for you.
Okay. What typically do you do when you get allergies and it affects the eyes? How do you help somebody?
Often with eye drops. Usually eye drops calm the inflammation right down and make the eyes much more white and clear and comfortable.
Okay. That is inflammation.
Yes.
Okay. Yeah, that darn inflammation, that gets in the body and causes problems no matter where it's at.
Yes. Yep. It can get flared up and just not really calm itself down until there's treatment involved.
Okay. And also you wanted to talk about urgent care appointments for eyes. Yeah, this is new.
Yeah. So anytime that you are really feeling like you're having a urgent eye care issue, maybe you woke up and your eyes red, puffy, hurting, maybe you ran into a branch or something flew into your eye outside and you may have a scratch. We see a lot of dogs or children scratch their parents' eyes, things like that. Don't feel like you need to rush to the emergency room. Give us a call. We would love to help you out same day and get all your needs taken care of. We love doing that, and it's usually a super quick appointment. We get you right in and out and get you all fixed up.
Sure. So, because a scratch to the eye, I mean, what do you do?
Yeah, definitely can be super painful. So really we need to locate it, see how big it is, get some treatment started, prevent infection, and get that healed up. The eyes heal quickly, so once the treatment's started, it usually is a quick fix.
Oh, thank goodness. Okay. And also contacts, newer technology that you're able to share with us.
Yeah, we are always getting new and updated and improved contacts, whether you're someone who suffers from dryness with contacts, or maybe you're someone who had a prescription in the past that was told you weren't a candidate to wear contacts. There are so many new options with soft contacts and with specialty contacts. We've been doing a lot more specialty contact fitting, especially at our Galesburg office. We have some new machines that can really well measure the curvature of the front surface of the eye. And those type of lenses can get people seeing much better than they have in years and years. So that is certainly a great option for people who have not been able to wear contacts in the past.
Okay. You know, there was a term that we used to hear a lot of 10 years ago and maybe even before that, Lasik surgery. Is that still a thing?
It is, yeah.
And when is it the most commonly used?
It is most commonly used in people who I would say are healthy in their 20s. It corrects for distance vision. And it's awesome for people in their 20s because they get their vision corrected for 15 to 20 years at that point. People around age 40 to 50 start to lose their focusing system. It starts to weaken. That's why you see people often grabbing reading glasses or having to wear bifocals because they need some help up close. LASIK does not typically correct for that. So typically people get LASIK when they're young before they have to worry about reading glasses and things like that. So they get good distance vision for 10, 15, 20 years before that sets in where they need the reading glasses.
Okay. So it's so I'm not crazy when I have to pull the receipt all the way away, stretch out my arm to actually see it without my cheaters, if you will.
Yes, you are not crazy. Yep, happens to everyone. Between 40 and 50, usually everyone has to start wearing something up close to help them out because the focusing system really just starts to go. And when it starts to weaken, it just keeps happening and rather quickly usually.
And I can't eat enough carrots to correct it, right?
Unfortunately, wouldn't that be awesome?
Is that an old wives' tale? I was told that growing up. Eat your carrots. It helps your vision.
It is. A lot of that is. Yeah, leafy green vegetables and vegetables in general are great for the eyes, but especially those leafy greens.
Okay. Mm-hmm. All right. Anything else you want people to know about Kehoe Eye Care?
I would say come by and see us. So we are going to be having an open house and some hot chocolate and things on December 1st during Christmas on the Square. So we'd love for you to stop in, see our remodel, get some goodies for you and your kids, and just say hi. We'd love to see you.
That's so cool. So yeah, that's December 1st during Christmas on the Square. And you get a chance to see the remodel, or if you have an appointment, or make an appointment if you would like. You guys do pretty much everything if it has to do with the eyes.
Yes, definitely. Anything going on with your eyes, give us a call. We've got you covered.
Okay, Dr. Braet, thank you so much for coming in.
Thank you for having me.
Dr. Allie Braet with us, Kehoe Eye Care in Galesburg and Monmouth on 1330 WRAM and FM.